So if you've done our airway ventilation respiratory continuing education online, you'll know I get a pretty good kick out of these designer backgrounds from PowerPoint sometimes. So pit crew CPR follow-up, I let PowerPoint choose the background, and I guess pit crews make them think of whitewater rafting. And I do have to agree that got to work as a team to get down a river, got to work as a team to do pit crew CPR. So anyways, I get a kick out of these. All right. So typically the way I do this training is in person. And with the in-person class, you know, my thing is you learn things by doing them. So we're online. We're not going to be able to actually do pit crew CPR as a team here, but I figure the closest we can get to learning that is to at least talk through what we learned in the in-person class for those of us that did the training in person. So you just saw a video of a practice team, but when I hold this training in person, the students come in, they know it's going to be pit crew CPR, they sign in and all that. And then I just say, okay, everybody ready to get started? They all say, yeah. And they're sitting in their nice little comfy seats. And I say, all right, you've been dispatched to a cardiac arrest in the other room. I have two classrooms in. Go. And everybody kind of just looks at me and I'm like, there's a cardiac arrest in the other room. Go. And they kind of go in there and do their best. And I record it so we can look back and see how they did. Then we come in and I say, okay, how'd that go? And they say, oh, terrible. They don't work together. They don't know each other. They just kind of jumped in and tried to do CPR as best they could. And so then we go through that pit crew method. Basically, the first video you all watch, we talk about what pit crew CPR means and what the goals are. And we really study that method from Christchurch, New Zealand that I studied with you all and demonstrated it. And then we try it again, and then we troubleshoot the problems. We try it again, and we keep going until we feel comfortable with what we've done. And so doing that with other students, I've learned some things that went well and some things that didn't go so well. So I'm going to talk about things that went well and things that didn't go well. And I'm not talking about the rehearsed, practiced team video that you just watched, but just when random students come in for this training and get thrown into this who don't have the training or anything like that, and what mistakes they make. So things that went well in the video we just watched, you notice that, somebody's immediately checking to see if CPR needs to be done. Chest compressions are started right away. Throughout the scenario, very, very limited interruptions to chest compressions, with that compressor hovering over the chest while the breaths are being given, while the AED's analyzing and all that. We can really limit our interruptions to chest compressions down to the bare minimum as best as possible. You saw compression speed was appropriate, compression depth was appropriate. We saw good chest recoil. When compressors made a mistake, the other team members were correcting them. Hey, slow down a little bit or speed up or whatever. We saw every 2 minutes that the AED was used and the chest compressors swap places so that nobody was ever doing compressions for a continuous 2 minutes. And then with those breaths, we saw chest rise every time with two rescuers on the BVM, making that easy to get a good seal and not having any wasted time of trying to get the airway open. The airway stayed open the whole time. And then it was just two squeezes of the bag and right back to chest compressions. So very short interruption to CPR to get those breaths in. And we saw tons of communication between the rescuers so that everybody was on the same page, watching everybody else, helping out other people, and just kind of working really well as a team. Now, when I've done this with students, one of the things that really happen, there's a couple things that happen, and the two big things are basically tunnel vision and communication. So what do I mean by that? Well, tunnel vision, if somebody comes in and they have their role, they already know what they're going to be doing, they jump in and they get into that role. Tunnel vision kind of gets them messed up in two ways. One, if they know their role and they jump in and they're just doing their own role and they lose track of what's going on around them. So they might not realize that, oh, it's time to give breaths, or, oh, the AED's analyzing, I need to stand clear, or like, oh, somebody else on their team made a mistake and they don't even recognize it because they're so busy and focused on their goal. The other, that's kind of the least of the two mistakes I see with tunnel vision. The bigger problem with tunnel vision is that when a team comes in and they don't know what their roles are, they know how to do CPR, they're trained in CPR, but they don't know how to do, they haven't trained with this team that they're working with right now on pit crew CPR. People kind of like pick one thing at a time. So they're doing chest compressions and everything's going well. And then somebody else speaks up and says, "Oh, should we have the BVM attached to oxygen?" And the person doing chest compressions, that gets their attention and they stop doing compressions and they're like, "Yeah, we probably should." And it's like, "No, you're doing compressions. Get back to your compressions." Because they're thinking and they're kind of stopping those compressions to do something else. So you want some sort of tunnel vision on focusing on your task at hand. That's the most important thing. But when you're not in the middle of doing those compressions, when you're taking a quick break to let those breaths go in, maybe that's when you look over and see, hey, the AED's not turned on, or they need an OPA or whatever. And then you get right back to your task. So you want your main focus to be on your task, but you also do want to kind of look around at the rest of the team and see if you notice anybody else that's off track and that you can make some quick corrections. And don't let that get in the way of you completing your own task. That was more, especially like when we go through it the first time when we haven't trained on pit crew CPR, that was always more of an issue that people will just kind of stop what they're doing because they don't feel tied to that role. They're like, yeah, I'm the one doing compressions now, but I can just stop. No, if you're going to stop compressions, you need to have somebody else take over before you stop. So those kind of things. Communication was a problem every single time that I've implemented pit crew CPR after training a new team. And, if even if they haven't had, from the first time they try it with no training to the second time they try it when they were just trained to that third iteration where we're all feeling really solid, communication is always the thing that causes the system to break down. So one of the things I've really noticed is that when somebody needs to say something, they they don't always just say the thing they're trying to say. They think about, okay, I'm new at this. This person, they work on an ambulance. I don't work on an ambulance. So they probably know more than me. So I think, I know they're wrong, but I'm just going to let them do it wrong anyways. That literally happens where, I'll have multiple students come in. Some of them work on an ambulance, some work in an ER, and some have not worked as an EMT. They're just fresh out of the class. And it's always interesting because the ones fresh out of the class, they know what high quality chest compressions look like. They know what the speed is, but they're the least likely to communicate that information. Whereas people who have been working in the field, maybe they haven't done CPR in a while and they don't know the right speed, or they're going too deep because it's a mannequin, or they're not going deep enough, or they get distracted and stop doing compressions. And that new student who is just fresh out of the class and knows the information is afraid to speak up because they don't want to, they're like, oh, they're more experienced than me, so they must know better. That is not the case. It's really important that if you see a correction that needs to be made, it doesn't matter if that person is your supervisor, if it's their first day on the job or their 10th year on the job, if they're a first responder all the way up to a paramedic. Everybody makes mistakes. And when you work as a team, especially in pit crew CPR, but really on any call, part of working as a team is that you communicate. Now, how you say it definitely is going to play a role, right? If you look at somebody and say, those are bad compressions. Well, first of all, that's just rude because you just said they're bad. Second of all, it's zero help. How are they bad? What do you mean? How's that going to help the situation? Okay, now they're doing bad. What does that mean? So you want to give constructive feedback. If you see somebody's doing bad compressions because they're too slow, tell them, speed up those compressions, or slow down those compressions, or go deeper on your compressions, or make sure you're getting good chest recoil. Give specific feedback of things they can adapt to as though you're teaching them how to do the skill. And also, say it in a friendly tone. And most importantly, after the whole scenario is over, you can come up to that person and say, hey, I'm sorry, I didn't mean to step on your toes. I just noticed your compressions were a little bit slow. And 99% of the time, that person's going to say, hey, thanks for having my back. I was distracted. I just wasn't paying attention. You're right. I was going too slow, or I was going too fast, or whatever. So make sure, don't let seniority or amount of training or anything like that influence you on not saying something when you should be correcting somebody else. When you work as a team, everybody there is responsible for the same goal, the best outcome possible for that patient. We all have the same goal in mind. If you notice something that's not going well, make a correction. On the other end of the spectrum, if you're the person who you're not sure about what you're supposed to be doing, make sure you speak up. If somebody tells you, hey, do the chest compressions, and you're like, oh, I slipped on the ice yesterday and my wrist really hurts. I don't know if I can do compressions. Don't jump in there and try it. Say, I have a wrist injury. I'll take breaths. Will you do compressions, please? And then later you can discuss it. Like, hey, sorry, I hurt my wrist or whatever. But speak up. Or if you're doing compressions and you're starting to get tired, speak up. I'm fatigued. Are you ready to swap after these 30? And switch places with the other compressor or the leader or whoever. But communication is, like I said, that's the biggest thing that causes this to fall apart. So, when you notice a mistake from somebody else, just make sure you communicate that clearly to the whole team and communicate it in a way that it can be corrected on in the moment. So we've learned all this stuff and we've been talking about, working with practicing this over and over and over and working with your regular team. Your regular team are the people you work with every day. So what happens when you're off duty and you're at the grocery store and somebody goes down in cardiac arrest and you have to do CPR? You don't have your team. Well, just remember to fall back on what are our goals of pit crew CPR? High quality, uninterrupted chest compressions. That's your number one goal. If you're, not on duty and you don't have equipment, call 911, push hard and fast on the center of the chest, send somebody to get an AED. That's going to do a ton of good. If you're on scene and another volunteer fire department shows up that you don't normally work with, cool. Just integrate into their team, ask what you can do to help or stay out of their way. Stand back and observe. And if you see something you can help with, jump in and help. Or if you see something that needs corrected, jump in and say, those compressions need to be deeper. I think they need to be deeper or faster or slower or whatever. So, if you need to do CPR without your regular team, you can still take these things we've learned from pit crew CPR and integrate them into any rescue. Basically, with that focus on those high quality chest compressions, that's really it. Everything about pit crew CPR is just getting high quality, uninterrupted chest compressions. So remember to focus on those chest compressions. Everything else is secondary to that. It's chest compressions first, then the AED, then we're worried about the airway. Those are kind of your priorities in order. So anyways, I hope this training helped you out with CPR and you feel more comfortable in addition to your normal CPR training. And again, I want to emphasize, if you really want to implement pit crew CPR, that needs to be practiced with your regular team, with the people you're going to work with, and it needs to be practiced over and over and over. And you need to get practice in every single role. If you're practicing the 3-person role, you need to do position 1, position 2, position 3, and know what all 3 of those roles are like. When you roll up and it's not your own team, you might not be saying, I'll take position 1. You might be like, I'll do chest compressions, you get the AED, you do breaths. And then there you go. That's, everything else will fall in order from there. And then once they get going, you can verbalize to the person doing ventilations, hey, you just hold the mask with 2 hands, I'll squeeze the bag. And then while the person doing compressions, when they get ready to swap, you're going to tell them, hey, you're going to take over squeezing the bag while I do compressions. And you can kind of basically train people up to the way that you do it without all those little fine details getting in the way. So, all right, like I said, I hope this helps, and I'll see you in the next video or the next module or the next training class. Thank you.